Ever tried to change the oil in your car while it's still running? That's kind of what treating liver failure feels like. You're dealing with a critical system on the fritz, and the stakes couldn't be higher. Today, we're diving into the world of artificial liver support, a field grappling with the challenge of replicating one of the body's most complex and essential organs. You sent us a compelling review article from the World Journal of Clinical Cases, and it doesn't shy away from the complexities.
What's fascinating about the liver is, well, it's not just one organ. It's like a whole team of specialized engineers tucked away in your body, each with a different, crucial job. Filtering toxins is just the tip of the iceberg. We're talking blood clotting regulation, nutrient processing, bile production, the list goes on.
You've got a point. It's easy to get stuck on the liver's role as a filter. But this article really highlights how much more it does, and that's why replicating it is such a challenge, right?
Precisely. Think about it. Artificial livers aren't about swapping out a simple part. They're about trying to build a system that can adapt and respond to a constantly changing environment, just like a healthy liver does. That's where things get incredibly difficult.
It's like trying to build a self-driving car that can also make you a cappuccino and balance your checkbook. And speaking of complex systems, this article categorizes artificial liver support, or ALSS, into three main types: renal replacement, absorption, and combination. It's a bit like choosing your approach to tackle a mountain, right? Each with its own path and challenges.
That's a great analogy. Take renal replacement, for example. It's the all-terrain vehicle of the group, often used in emergency situations, like acute liver failure. Imagine your liver is overwhelmed, struggling to keep up with toxin removal. Renal replacement swoops in to help with that filtering process, buying precious time for recovery or a transplant.
It's less about permanently replacing the liver and more about providing temporary support, like a lifeline in a crisis. What I find interesting is how it focuses on cleaning the blood, much like dialysis does for failing kidneys. Why the focus on blood when it's the liver that's in trouble?
That's because when the liver fails, it's not just toxins that build up. It's also about maintaining the right balance of fluids and essential substances, like electrolytes. Think of it this way. High ammonia levels in the bloodstream, a common issue in liver failure, can be incredibly dangerous, leading to complications like brain swelling. Renal replacement modalities, specifically continuous renal replacement therapy, or CRRT, are often the go-to for managing this.
So CRRT is like the emergency medical technician, stabilizing the patient while the real work begins. What about these adsorption methods? They sound more like a targeted strike team.
You could say that adsorption is all about precision. These systems use specialized materials, almost like high-tech sponges, to capture and remove specific toxins directly from the bloodstream.
Okay, that makes sense. It's not just filtering everything out. It's about grabbing those particularly harmful substances. Tell me more about these high-tech sponges. How do they actually work?
Let's look at a system called Cytosorb, highlighted in the article. It uses biocompatible beads that act like molecular magnets, attracting and holding onto specific toxins as blood flows past them. This targeted approach is incredibly promising, especially in cases where certain toxins are causing the most harm.
It sounds almost too good to be true. If these systems are so precise, why haven't they replaced transplants altogether? What's the catch?
That's the million-dollar question. One major hurdle, the article points out, is the sheer diversity of substances the liver has to deal with. Imagine a security system programmed to stop only 10 specific threats. It might work for a while, but what happens when threat number 11 comes along?
You're saying it's like playing whack-a-mole with toxins, and the liver is always one step ahead.
Exactly. The liver is dynamic, constantly adapting to new challenges. Replicating that level of flexibility and responsiveness is something artificial systems are still working towards. And that brings us to the all-hands-on-deck approach of combination therapies. Combination therapies take the two heads are better than one approach to tackling liver failure. Instead of relying on a single method, they combine elements of renal replacement and adsorption to target a broader range of toxins and liver functions.
It's like bringing in a whole team of specialists instead of just one general practitioner. The article dives into a couple of these systems, Mars and Prometheus. It sounds like Mars is the veteran of the group.
MARS, or Molecular Absorbent Recirculating System, has been around for a while and has a pretty impressive track record, particularly when it comes to removing bilirubin and ammonia, two substances that can accumulate to dangerous levels in liver failure. It uses a unique approach. That involves filtering the blood through a special albumin solution, essentially cleaning it before returning it to the body.
So it's like giving your blood a detoxifying spa treatment. Sign me up. But seriously, if it's so effective, why isn't it more widely used?
That's the catch with a lot of these advanced technologies: complexity and cost. The article points out that Mars requires specialized equipment and trained personnel to operate, making it more accessible at larger medical centers.
It's not exactly something you'd find at your local clinic. It seems like accessibility is a recurring theme in this field. What about Prometheus? How does it stack up against Mars?
Prometheus is another albumin dialysis system, but it casts a wider net, so to speak, targeting a broader range of toxins than Mars. It's shown particular promise in addressing hepatic encephalopathy, a serious complication of liver failure that affects brain function. However, the article also highlights some conflicting findings regarding its impact on long-term survival rates.
That's concerning. What could be contributing to those inconsistencies?
That's where the need for more research comes in. It's possible that certain patient groups respond better to Prometheus than others, or that the timing of treatment plays a crucial role. These are questions that further research, and those all-important randomized controlled trials can hopefully answer.
It's a good reminder that even with these advanced systems, we're still piecing together the puzzle of how to best support a failing liver. Speaking of different approaches, the article mentions plasma exchange as having some of the most promising results so far, particularly as a bridge to transplantation. It feels like a more drastic approach. Is that accurate?
Plasma exchange, or PE, takes a refresh and replenish approach. It involves filtering out the patient's plasma, which is where many toxins accumulate, and replacing it with healthy plasma from a donor.
It's like swapping out contaminated oil in a car engine. You're removing the bad stuff and adding in fresh, clean fluid to keep things running smoothly.
That's a great way to put it. And what's particularly interesting about PE is that it doesn't just remove harmful substances, it also replenishes essential components of the blood that the failing liver may not be producing enough of, like clotting factors.
So, it's a two-pronged attack, cleaning up the mess and providing vital support at the same time. Are there any downsides to this approach?
Like any medical procedure, there are potential risks. The article mentions the possibility of allergic reactions, as well as the standard risks associated with blood transfusions, and of course, it requires access to a ready supply of healthy donor plasma, which can be a logistical challenge.
It seems like logistics and accessibility are constant hurdles in this field. What I'm curious about is what these systems mean for the future of liver transplants. Is it possible that one day these artificial livers could completely replace the need for organ donation?
That's the holy grail, isn't it? And while we're not there yet, the research is incredibly exciting. The article mentions a couple of systems under development, Dialive and Carbolive. That represents significant steps forward in artificial liver support.
These names sound like something out of a science fiction movie. Tell me more about Dialive. What makes it different from the systems we've already discussed? Dialive. It sounds like something out of a futuristic medical drama. What's the story with this system?
It's a pretty elegant solution to a complex problem. Imagine a two-stage filtration system, almost like having two specialized cleaning crews working in tandem. The first filter focuses on what we've already discussed, removing toxins from the bloodstream. But here's where Dialive gets really interesting.
Okay, you've piqued my curiosity. What's the second filter doing?
It's all about albumin. Remember how we talked about albumin acting like a toxin sponge in the blood? Well, Dialive's second filter removes the patient's albumin, which may be saturated with toxins, and replaces it with fresh, clean albumin.
So it's like giving the toxin sponge a good rinse and putting in a fresh one.
A very apt analogy. And that's what makes Dialive so promising. It addresses one of the major limitations of current artificial liver systems, the ability to keep up with the constant influx of toxins a failing liver can't handle.
It sounds like a real game changer. And what about that other system you mentioned, Carbolive? It seems to take a totally different approach.
Carbolive tackles the problem from a different angle. Literally, instead of focusing on the bloodstream, it targets the gut, which plays a surprisingly crucial role in the complications of liver failure.
Hold on, the gut. I thought we were talking about the liver. What's the connection?
It's all about something called bacterial translocation. You see, our gut is home to trillions of bacteria, most of which are harmless or even beneficial. But in liver failure, the gut's protective barrier can become compromised.
So things that should stay put in the gut start leaking out. Not good.
Exactly. These bacteria and their toxins can escape into the bloodstream, triggering widespread inflammation and even sepsis, which is a life-threatening condition. Carbolive aims to neutralize this threat at its source.
Okay, I'm listening. How does it work?
Think of it like sending in a specialized cleanup crew. Carbolive utilizes a special type of carbon absorbent that acts like a magnet for bacterial toxins. The patient swallows it, and it goes to work directly in the gut, binding to and neutralizing those harmful substances before they can wreak havoc.
It's amazing how much research is going into these different approaches. But with all these promising technologies, why haven't we cracked the code on a fully functional artificial liver?
That's the million-dollar question, isn't it? The truth is, we're still in the early stages of this field. We're talking about recreating a dynamic, complex organ with intricate functions that we're still unraveling. The article stresses the need for further research, especially larger randomized controlled trials, to truly understand the long-term effectiveness of these systems.
It's a good reminder that scientific progress isn't a sprint, it's a marathon. But with each new study, each new system developed, we get a little bit closer to the finish line.
Absolutely. And while artificial livers may not be ready to replace transplants just yet, they represent a beacon of hope for patients and their families facing this challenging disease.
It's been a fascinating deep dive into the world of artificial livers. You've given us a lot to consider, from the intricate science behind these technologies to the very real challenges researchers are still grappling with.
My pleasure. It's a field that's constantly evolving, so it's always exciting to talk about.
And for you listening, if this deep dive has sparked your curiosity, I encourage you to delve deeper into the fascinating world of artificial organs. It's a field where innovation and compassion intersect in extraordinary ways. Until next time, keep those minds curious.